In Chapter 31, we'll be moving on to antihistaminic drugs and mast cell release inhibitors. So in other words, allergy medications and medications that will help sort of cut down on that inflammatory response as far as the sneezing, difficulty breathing, etc. So, starting on slide 5, the action of histamine. Histamine is found throughout the body. It is released into the blood when the body comes in contact with an allergen. Histamine interacts with membrane receptors, so to cause that allergic response. So it's usually found in mast cells and basophilic white blood cells. And mast cells are usually found along the blood vessels, and they contain granules of bioactive substances. So the largest concentration of mast cells are in the lungs, the gastrointestinal tract, and the skin, which should make sense for allergic responses because we usually see those showing up on our skin as well as possibly in our airway. So the first time a person comes into contact with that allergen, such as a dust mite or tree pollen, white blood cells produce antibodies, specifically IgE immunoglobulin. On the repeated exposure, the allergen binds to the IgE and triggers the release of mast cell contents. So those mast cell contents, like we said, include histamine and also includes a lot of other stuff such as heparin, serotonin, prostaglandins, leukotrienes, platelets, and eosinophil activating factors. Histamine interacts with the membrane receptors in certain tissues to produce the symptoms of allergies, such as itching, redness, stuffy nose. And this is a type 1 hypersensitivity reaction because the response is immediate and not delayed. So on slide 6, there's a little picture of exactly what I just talked about. A little easier for you to see maybe in a picture than it is just listening to it. So histamine can cause the following effects. A drop in blood pressure because it dilates small blood vessels and capillaries. With large histamine concentrations, this drop can result in hypotension and circulatory collapse. So for example, someone allergic to bee stings or a nut allergy, when they come into contact with that allergen and it releases histamine, histamine causes such a big drop in blood pressure that it causes circulatory collapse. In addition, capillary dilation in the skin results in localized redness, called erythema. Localized dilation and redness in the eye are signs of allergic conjunctivitis. It can cause nasal congestion because histamine causes fluids and proteins to leak out of the capillaries and into the nasal passages. In addition, it can cause hives, itching, as well as pain. So, the actions of histamine, we're moving on. So histamine can also cause an increased peristalsis or movement of the gut, as well as diarrhea. Rapid heartbeat and high levels can lead to shock, which is associated with that circulatory collapse. So on slide 9, there's a nice little chart there that has all of the responses following histamine release, histamine stimulation, which we just talked about. So blocking allergic reactions. It can be one of two things. We either prevent those mast cells from releasing their contents, or we block the receptors so that histamine can't bind to its receptor. Mast cell release inhibitors. So cromolyn sodium is our drug here. It's not a bronchodilator, a smooth muscle relaxant, or a histamine receptor antagonist. It is a mast cell release inhibitor. This drug has no effect on histamine receptors, therefore it must be given before histamine release has begun. Drugs like cromolyn sodium, which prevent the onset of symptoms or disease as a result of exposure before the reactive process can take place, are called prophylactic drugs. They're preventative. There are 4 drugs in addition to cromolyn that inhibit the release of histamine, and they are Bapreve, cromolyn, we talked about iodoxamide, and nidocromil, and pamurolast, although cromolyn is the one you see most commonly. Most of the other ones are ophthalmic solutions. That would be used in conjunctivitis or inflammation of the conjunctiva. Cromolyn sodium can be used in allergic reactions, maybe in someone who has a serious allergy that needs to be prevented. Otherwise, you see them a lot in eye drops. So mast cell release inhibitors are effective in reducing itching, as well as mucus discharge, hyperemia, which is that red-looking eye. In severe cases, they might be used with mild corticosteroids to cut down on swelling. Cromolyn is currently used as a prophylactic adjunct or one of several drugs in the management of chronic allergic rhinitis to prevent bronchospasms and ocular allergy. All of the ophthalmic drugs we talked about are used for allergic conjunctivitis and keratoconjunctivitis. Oral cromolyn improves diarrhea, flushing, headaches, hives, abdominal pain, and nausea in some patients with mastocytosis. Adverse effects to these medications include wheezing, nasal itching and burning, nausea, drowsiness, and headache. And if you're using them in the eyes, of course, stinging of the eyes is always a big one too. Slide 13 has a list of the inhibitors as well as what they're indicated for. And don't pay too much attention to the dose because you don't have to memorize that. So, those drugs that block the receptors are called antihistamine H1 antagonists or antihistaminics. They block the histamine from binding to the H1 receptor, and they're used to relieve symptoms of an allergic reaction after histamine has already been released. So they're separated into first generation and second generation categories. And your first generations are, of course, your older ones: brompheniramine, chlorpheniramine, diphenhydramine, and promethazine. They usually are non-selective, so they have effects on central nervous system as well as peripheral nervous system. These drugs can be used interchangeably, but because they have effects on the nervous system, they will cause drowsiness, sedation, in addition to allergy relief symptoms, relief of allergic symptoms. The second generation is a little better at not causing all of those other problems. They include cetirizine, fexofenadine, loratadine, and levocetirizine. Some of you might be familiar with the common brand names of those: Zyrtec, Allegra, and Claritin. And they are more selective for the peripheral H1 receptors, therefore they do not interfere with the central nervous system. So they're not as sedating or drying. However, they are as good as the original first generation drugs. Long list of indications: itching, local surface pain from insect bites, hives, hay fever, rhinitis, dermatitis, motion sickness, as well as sleep aids, because the first generation specifically are used for sleep aids because they do cause drowsiness. There's a list on 17, covers the drug as well as the recommended doses. Don't pay too much attention to those doses. Again, I wouldn't want you to worry about them. Side effects: most of them cause drowsiness, less so with the second generation, as well as dry mouth. Adverse effects include hypotension, rapid heartbeat, anorexia, epigastric distress, as well as urinary retention. If we use these drugs in the elderly, they will cause confusion, so we do have to be careful there. We want to be careful also in using these drugs in patients with cardiovascular disease, as well as hypertension and prostate enlargement. These drugs should not be used in pregnant women, newborns, or infants, premature infants especially. And they shouldn't be used by nursing women because they can be passed into breast milk. Drug interactions are covered on the last slide there. Keep in mind, any drug that has an anticholinergic side effect, such as drying or a sedation side effect, will potentiate the side effect of especially of our first generation antihistamines, meaning it'll just make somebody more drowsy or have greater dry mouth. That covers chapter 31.